We looked at the definition of public health, the goals of public health, the objectives of public health, and the careers of public health. Okay, so that is what we looked at. And this now leads us into a discussion to do with the competences of public health, or public health core competences. What are those skills that you should, skills, competences, attitudes? So when we talk about core competences, usually we are referring to the knowledge, the skills and attitudes that you should be having in order to thrive in the field or in the career of public health. So if you have these things, it means that you can execute the core functions of public health, whether at your local public health departments or at a national level, or in a private non-profit public health organizations, or even in non-profit public health organizations. So you need to have these core skills. So what are they? The first one is that you need to have the knowledge, the foundational knowledge in the core sciences of public health. When we talk about the core sciences of public health, or when we talk about the core modules of public health, we are referring to epidemiology, biostatistics, behavioral sciences, environmental health, and also health management and policy. These are the 5 major areas of public health, and usually we say these are core modules of public health. So these you need to have the knowledge in all these subjects, because it is these subjects that provide a solid foundation for you to understand public health. The second thing that you should be good at is how to handle data, data handling. And in this case, this data is used to assess the health problem, to what extent is the health problem, and what are the trends. Do we have the health problem increasing or decreasing? So therefore, you need to be very good in handling data, whether it is collection, whether it is analysis, whether it is dissemination. You need to be very good at that. You need to be very good at policy making, program planning, implementation, and evaluation. Basically, you need to be very good at managing programs, because with programs you start from the initiation, program initiation, planning, execution, evaluation, and closure. Okay, but at the same time, you also need to be very familiar with the processes involved in making policies. And of course, this usually you are going to interact with the people, interaction with the people, the different stakeholders, different groups with different interests. So that means that you need to be very good at negotiation, very good at managing conflicts or managing interests. You need to be very good at communication, negotiation, conflict management, and many other aspects, including aspects of being competent as far as inclusivity is concerned, and working with people of diverse backgrounds, because you are not going to work with people who share the same cultural background like yours. So cultural competence, cultural sensitivity, you need to be very, very, very aware of these things. Leadership is very important, especially because public health involves negotiations, involves dealing with people of different stakeholders, involves convincing people to buy into the ideas that you are fronting. So that means that you need to be able to lead people to the desired, such that you can achieve the desired outcomes. Okay, so like I said, public health is not a discipline of you interacting with a single patient, just like in clinical medicine. Public health involves interacting with different stakeholders, those that have authority or power, and then those that are vulnerable, and then those in the communities, those that are marginalized and things like that. So you need to be able to be, you need to be a very good communicator. Okay, you need to be a very good communicator, policy communicator. You need to be very good at one-on-one communication. You need to be very good at disseminating health messages using different media platforms and things like that. Partnerships, collaborations, and advocacy. There is nothing that you can achieve alone in public health. You need to work with different partners and groups. And this usually involves building relationships that are productive, that will yield positive results.